Hello. Today I'll be going over strokes for the tummy or the abdomen. That ends when our sternum ends and goes down to our pubic bone. On our baby here, I have a clock. We don't want to draw this on all our babies. However, this helps us understand the direction that gas and poop has to follow to exit the body. So, if we think about our clock, we want to be going in a clockwise direction with most of our tummy strokes. Just like with all our massages, we want to start with our resting hands and make sure our baby's ready. Hi, baby. Would you like a tummy massage? We look for affirmation, cooing, positive things. We don't want a crying baby. We don't want a distressed baby. Our baby's ready, and so we're going to start with our walking across. So we're going to take 2 fingers on either hand, and we're going to start at the baby's right hip, and we're going to walk across. And so each time one of the fingers goes down, the other one comes up. Just like if someone was jumping on a trampoline with you. When they land, that force brings you up. So, we're going to start. 1, 2, 1, 2, 1, 2, walking across. We're going to use both hands, little by little. We're not compressing a ton, but we do want some resistance. Good. So our next stroke we call yummy tummy, because we're going to use the bottom third of our hand to come from the top and bring it all the way down. We're going to alternate hands and keeping one hand always on the belly, helping the baby. Move the gas. May help relieve constipation, and it also helps relax the abdominal muscles. The reason we use the bottom third of our hand is because we don't want pressure directly on the navel or belly button. This is especially important for infants that still have their umbilical cord stump attached, and we can actually go and use strokes on either side of it as a variation. Our next stroke is also really helpful for babies who still have their umbilical stump, and that is we're going to use our fingers or thumbs to provide a nice heart coming up, out, down, and in. Up, out, down, and in. This motion, on one side, we're providing pressure to help move gas and poop forward, and then the other side, we're doing the opposite. So it's important to finish with a stroke or 2 that goes from the baby's right side up, over, and down, following the path of that colon, just making sure we're not pushing anything in the direction that we don't want it to go. Our next stroke is a combination stroke, which one hand is going to go from 12 to 6, and the other hand is going to go from 8 to 8. So our left hand is going to start at 8 and provide a pressure. As soon as it passes 12, or right above the belly button, we're going to add our second hand that goes 12 to 6. So we're going to bring, keeping the left hand down, providing that extra little bit to help what is called the descending colon, and that last bit to help the poop move into the rectum and out. Babies can actually poop, fart while you're doing this, and in those instances, that's normal. If you have something underneath them, like a diaper, if you have the baby naked, or you can do these strokes with a diaper on. The next stroke is called ICU because it is an I, a backwards C from 12 to 6, and then a U from 9 to 3. This stroke can be done with one hand, so you can support the baby's head, the baby's back, and it can be done with them resting in your lap. You can go I, C, U. The pressure on this is a moderate pressure. You want to depress the skin, but you shouldn't feel a lot of pushback or resistance. If you do, it may be because your baby's a little constipated or has a lot of poop in there. So we want to make sure we go I, C, U. I, C, U. And what this does is it helps move the gas and poop down and out, passing across midline and into the descending colon, and then the upside down U helps move it through the full area. So this can help with gas, constipation, and support bowel movements. So it's not uncommon for those to occur. If they haven't occurred when you're doing this massage, and the massage is for that purpose, you can do some body integration, and instead of just doing our resting hands like we would normally do when we're completing our massage, saying, "Thank you, baby, for allowing me to provide you a massage today," we can go to the legs and gently flex up their legs, bringing their knees up towards their chest, and it can help the baby relax and organize, meaning that it helps bring them closer to their body, helps them ground, and reminds them that we're going to be doing something else, which may be cleaning up their poop. This is really nice, a way to integrate for babies less than 6 weeks old. And you may find that this helps them move their bowels, either farting or pooping, but then coming back to our resting hands. And that concludes our strokes and massage for the tummy, abdomen region. Thank you.